Today is May 25th, 2022. Thank you, Andrea, for starting the recording. So we will dive into our staff updates. Andrea, do you have any updates other than what is on the agenda later to share with us?
Excuse me. Thanks, Hillary. Not a whole lot. I think the thing that I just want to share with everybody is, as you're aware, my position is grant funded through the state of New Hampshire through the Bureau of Drug and Alcohol Services, similar with Danielle's and Lauren's. And the thing that I want to share with that is we are in the process of submitting a new contract for the year. So until we formally get awarded that contract, I don't have any true ideas of when my upcoming work plan will be due. So the reason I bring this up to the group is I'm aware that my 3-year strategic plan is something that I'll have to be working on over the next upcoming months, hopefully about 6 months or so, but we don't really have a deadline because they can't give us any information until we go into contract with them or renew the contract. So I say this because I really would like to enlist the help of all of you, our partners, to at least have some one-on-one conversations so I can get a little bit more information in terms of what you're seeing in the community and what really you'd like us to be focusing on over the next 3 years as part of this. Like I said, it's my substance misuse prevention coordinator work plan. It's not the altogether work plan. It's my specific one that I have to follow as for my contract. So just wanted to give folks that heads up. I haven't, again, we don't have any dates yet, but please keep in mind that if I reach out to you, it's to help me gather information and do this assessment for this 3-year strategic plan that's coming up. Otherwise, we had Take Back Day back at the end of April. It went well. We partnered with Lebanon PD to go to a number of senior living apartment complexes to be able to offer the residents there a safe way to dispose of their medications if they're not able to not able to easily get out of their apartment and get to a local police department. So that went really well. And I don't have a full total yet. I think some police departments were not able to drop off what they had collected the following day with the DEA. So I'm waiting to give you a final total until I really have the overall picture of what that was. So otherwise, I think my other updates are going to come later on in specific parts of the agenda. So that's it for me. Thanks, Hillary.
Thanks, Andrea. Lauren, are you in a place right now where you can provide some updates for us?
Yes, thank you. I don't have a lot of updates either, but I'll just mention, I think we've talked about it before, that the rapid response crisis number is changing to 988 in July. And I just got 2 huge boxes, you can see behind me, of some of those 988 rapid response promotion materials. So there are like 1-pagers, there's brochures, and there's little wallet cards. So if anyone is interested and wants those materials to have at your location or to distribute to anyone you work with, let me know and I can coordinate getting you some of those materials. They are in English and in Spanish. I believe all of them are. I'll double check though. And then I just wanted to also remind folks that I can provide training on overdose prevention and how to use Narcan. So if you or anyone you know or any other organization you hear of is looking for training on Narcan or Narcan kits, I can also assist with that. So you can get in touch with me. I think that's all that I have.
Great. Thanks, Lauren. Danielle, did you have any updates you wanted to share?
Yeah, I think the only thing that I wanted to update about is that Friday is actually my last day in this position. I accepted a job offer at Elliott Hospital as a program coordinator. So I will no longer be in this position, but you'll still have Hillary, Lauren, and Andrea to answer any of your questions. So.
Thanks, Danielle. We're sad to see you go, but excited for your next chapter and appreciate all the work that you've contributed to both our region and Greater Sullivan County over the last year. Updates for me, most of my updates will come towards the end of our agenda, but did want to share we have purchased some All-Together swag. We've got some pens and some tote bags, so we are hoping to be able to do some more like tabling events. We were at Hypertherm's Volunteer Fair last week. Thank you, Stacy, for including us in that. And we're just really looking forward to being able to be out more in the community more. So we do have some fun little things. We have stickers too and medication lock boxes. So if you hear of events coming up in the community and you think having all together as a presence would be beneficial, let us know. If we as staff can't attend it, we would love if coalition members would raise their hand and volunteer to represent all together at these events. So next on our agenda, Amanda is here to talk a little bit more with us about the Phoenix. So we'll turn it over to you, Amanda.
Hi again, everyone. I'm working on establishing a local sector of this nonprofit organization called the Phoenix. They're a really interesting group. They establish different hubs across the U.S. and their goal is to bring people together in a sober, active environment. So volunteers hold different activities, physical activities, things like climbing events, yoga. They're really big in the CrossFit community. And so I was thinking that we could use something like that in the community, but they didn't have any local activities. So I reached out and have been working to coordinate something. So we have a skateboarding event and social coming up on June 11th. I gave Lauren flyers to distribute to the group. So if you know anybody who would be interested, they do not have to participate in the skateboarding. We'll have lawn games and just kind of be there to talk and connect. But if somebody's interested in learning how to skateboard, we have 2 people who will be instructing, one of who owns the local skateboarding store in West Lebanon. And we'll have some equipment for people to use, helmets and skateboards and whatnot. So we're really excited about that. And I'm also working with the CCBA to set up some sort of weekly or bi-weekly event. They're very generously providing space in their double gymnasium each weekend. So we're trying to figure out what events we want to hold. If anybody has suggestions, let us know. We're not too sure what the community would want at this point. So I was thinking about maybe setting up yoga, and I talked to a couple of people with yoga teacher training in the community who are willing to volunteer some time. We were also thinking about maybe basketball or dodgeball, but if anybody has any suggestions, we're very flexible and open to hearing what people might want. So very excited about that. Yeah. Lauren, is that you?
Hi. Do you think, or maybe you're already planning to do this, but do you think it would be good for anyone to table there and or maybe bring some Narcan and do some training if folks are looking for that?
Yeah, that actually is a great idea, and I should have thought about that when you guys just mentioned that. I think that would be great. We would love to have somebody do some Narcan demonstrations and training. And I was thinking, because I hadn't had time to reach out to like local restaurants. We wanted to do kind of a cookout, and I just didn't have time to organize that and get donated food. And unfortunately, I just don't have the funding right now. So I was thinking about asking a food truck to come. I was going to kind of go to the Lab Farmers Market, and I know there's usually local food trucks there, so that we could at least have some food available. I know that the New Hampshire project coordinator for the Phoenix is coming along, and he said he'll bring some beverages and snacks, but it's not the caliber that I hoped for. But yeah, we'll have long games and whatnot. So yeah, I think it would be great to come and do that training. So if you'd want to talk about that, and I could swing it by the project coordinator who I've been working with. He's pretty much let me take a lot of independence in setting up this event. So I think they would be totally down with that happening. And we've also been in communication with the Lebanon Parks and Recreation Department just to make sure that everything's good to go. So I would just want to update them as well. But
I guess I would wonder if you think it would be appropriate for like the doorway to be there to do the training and provide the kits, or if you would want any of us all together staff to do it. Either is fine. I know you work with the doorway, so
Yeah. So I work a little bit with the Doorway. I don't work directly with them. I don't know. What do you think would be what do you think would be better for this sort of an event?
I think it could go either way. I think having all together there as a community coalition would be great to, raise awareness about all together, and we can certainly provide some training and Narcan kits and lots of other resources as well. So I think we could cover a lot of bases with all together doing it. I just wouldn't want to step on any toes if that's something that like the Doorway would rather
No,
do.
and I have some time tomorrow at our meeting here at ATP to talk about this, but this is totally separate from work. So I don't think it would be stepping on anybody's toes, and we would love to have you there. I think it would be great to spread awareness. So
Okay, I think between the three of us, we can figure out a plan for doing that.
great, thanks. Does anybody
If you,
have any questions?
if you have an electronic flyer, we can attach it with the minutes for the meeting as well, Amanda.
Yeah, perfect. Thank you.
Yeah, as you can tell, my computer is like, I'm ready to throw it out the second floor of our building. Because how many times can you reboot in like a 15-minute time? I'm not sure, but I'm certainly working on the record. Anyway, I did just want to say that I'm really interested in learning about the details about the event and continuing to stay connected with your organization. I want to share it with our recovery network affinity group. I think there'll be a lot of interest. So yes, we can definitely start to promote things internally here at Hypertherm. So
Wonderful. Thank you.
And Stacy, while at least your audio is working, do you want to quickly introduce yourself and then let us know what song is always playing when you're mowing the lawn or doing chores around the house?
yeah, so Stacy Kyokyo at Hypertherm. I also am someone that listens to all different kinds of music, so no particular song. I grew up, my dad had a record store in New York City, so I grew up with lots of music of different types all the time. But our team has a song that, in corporate social responsibility, sometimes you get a little deflated because I don't know, somehow everything else seems more important to other people, right? And you're like, hello, hello. So our team likes the Miss Piggy Shake It Off video. And so we often will play that song and watch the video, and that revives us and restores us. So I guess I'll just share that with all of you. If you're ever having a frustrating moment, because all of us do really hard work, right? Play that song and you'll just feel better.
Thanks, Stacy. That's awesome. I'm gonna have to watch that video later.
Oh yeah, you have to.
Thank you. Um, Anyone have questions for Amanda? Okay, thank you so much, Amanda. Oh, Lindsay.
Thank you, Hillary, for catching my thing. I appreciate you very much. I might have missed it because I was trying to take really good notes, but are you targeting a specific age group?
So we're not targeting a specific age group. The only cost of admission really is 48 hours of sobriety. So all ages, all genders, all abilities, we wanted to make it as inclusive as an event as possible, and future events will probably be along those lines.
So if you want, I'll put my email in the chat, and if every time you have an event, if you want to send me a flyer, I will share it with my staff.
Wonderful.
And because we have contact with people who are working hard, some of us, staying, be the best we can be to be healthy. So we have access to a lot of people. So I'd be happy to put a flyer in the building and then share that with staff. So I'll put that in the chat right now.
Thank you so much.
Great, thank you. So next on our agenda, Danielle is going to run us through her findings from her young adult strategies assessment. So Danielle, I will let you share your screen and take it away.
Okay, perfect. How's that look?
Perfect.
All right, so yes, as I've mentioned in the past, I wrapped up my young adult assets and gaps assessment. So the purpose of this assessment was to determine the assets and gaps facing young adults specific to substance misuse and mental health, and then specifically within the Upper Valley and Greater Sullivan County regions. So some quick background on methodology for this assessment. So I did 11 key informant interviews, and the participants of these interviews were broken down into 3 categories, which were employers of young adult service providers, and then young adults themselves. There was 1 young adult focus group conducted, which I was hoping for definitely 3 or more, but due to lack of participation, it only ended up being 1 listening group of 4 young adults. And then some secondary data, which you'll see in the slides coming up, came from the New Hampshire County Health Rankings Report, the Voice of New Hampshire Young Adult Survey, and then New Hampshire Young Adult Assessment, and then just some basic background data. So a quick note on these next few graphs that you'll see. This data is based on counties, not public health regions. So you'll see I have New Hampshire as a whole, and then Sullivan County and Grafton County. So this graph is portraying prevalence of substance use as a percentage. So you'll see in the next few graphs that blue is New Hampshire as a whole, green is Sullivan County, and then a gray color will be Grafton County. So looking at different categories, Grafton County young adults reported higher rates of current alcohol usage at around 70%. As you can see, that gray star seems to be above the New Hampshire as a whole, as well as Sullivan County. And then going down the line, binge drinking in Grafton County is reported at lower percentages compared to Sullivan County and New Hampshire as a whole. And then vaping seems to be, around the same prevalence. And then marijuana use, New Hampshire as a whole is higher than the 2 counties. And then illicit drug use, they seem to be grouped together as well. And then this graph is representing perception of harm. So overall, approximately 40% of young adults felt that substance use impacts social groups somewhat or a great deal. So as you can see, for each of a higher perception of harm is good. Okay. I don't think that's it. Yeah, so a higher perception of harm is good for each category. In the first category, you can see that Grafton County is lower than the other 3. So young adults reported that 1 to 2 drinks nearly every day has around only a 30% percentage of perception of harm compared to the New Hampshire as a whole and in Sullivan County. And then young adults in Grafton County reported a higher percentage of perception of harm from marijuana use as well as e-cigarettes compared to the other 2. Okay, so this was the graph. So this is young adults reporting if substance use impacts, how it impacts their social lives. So in overall, approximately 40% of young adults felt that substance use impacts social groups somewhat or a great deal. As you can see, it's 40% in Grafton County reporting that they believe that substance use does impact their social life somewhat or a great deal. And it's higher in New Hampshire as a whole and a little bit higher in Sullivan County. And this graph is representing percentage of young adults who reported age of initiation under 15 years old. So in this graph, on average, 23% of young adults reported drinking alcohol for the first time before the age of 15. So as you can see, the first grouping is alcohol. So that is in Grafton County, 21.5% reported drinking alcohol under the age of 15 or before the age of 15. And then 13.1% of young adults reported binge drinking before the age of 15. And then 28.1% of young adults reported marijuana use under the age of 15. And this graph is representing sources of mental health support for young adults. So as you can see, kind of across the board in New Hampshire, Sullivan County, and Grafton County, young adults mostly talk to their friends and significant others when they are seeking support. So again, the significant other and friends bars seem to be much longer, but parents, guardians, and caregivers seem to be right behind as well. And then this graph is showing prevalence of depressive symptoms for young adults. So as you can see, 31.6% of young adults in Grafton County indicated that they have depressive symptoms, compared to 30.4% in Sullivan County. Okay, and then, so I'm going to go through the 3 different categories, and for the purposes of this presentation, I just chose 2 of the about 10 or so questions that were asked to analyze the key themes of. So the first question that was asked of employers of young adults is, what do you believe are the most pressing issues facing the young adults that you interact with? So some key themes that came out of this from employers were substance misuse, financial stress, and mental health. And then another question that was asked of employers of young adults was, what risk factors or gaps in resources are impacting the young adults in your community or that you see in your workplace? And some themes around this were stigma around mental health, trauma, as well as lack of follow-up help after a crisis occurs. So again, these are the same questions, but these themes came from young adult community service providers. So young adult community service providers reported that substance misuse was a pressing issue facing the young adults that they interact with. And they reported specifically alcohol in their, substance of choice for young adults that they're seeing. And then mental health and financial stress were also reported as pressing issues for young adults that they interact with. And some risk factors that were reported by young adult community service providers that may be impacting young adults in their community are waiting lists for mental health services, limited access to resources in the community, and community acceptance of drug and alcohol use. And then young adults themselves reported that some pressing issues were mental health, school stress, and substance misuse. And then they also reported that some risk factors or gaps in resources that may be impacting them were lack of awareness campaigns in the community. Again, that normality of drinking and marijuana use in the community or on their college campuses. And then lack of walk-in services or no walk-in services in the community. So as you can see across the 3 different categories of people that I spoke with, there were some very common themes, such as, substance misuse and mental health being pressing issues, as well as some themes and gaps in resources, such as no walk-in services or lack of services in the community, specifically around mental health and substance misuse. And then I also wanted to note that there were questions that were asked around assets in the community. I just didn't pull those out, but I did want to highlight some of the identified strengths that came out of those questions. So one of the first ones was that there are engaged businesses in the 2 communities who do want to invest in the success of young adults. And then most young adults in the regions have someone they can talk to, as we saw in that one graph. With both friends and significant others identified as sources of support. And then another identified strength was that less than 11% of young adults reported the use of illicit drugs, as we saw in that one graph back a few slides. And then also that there's a lot of collaboration that seems to be going on between community providers and agencies to better serve the young adults that are in our community. And then reported from the young adults themselves that there are some on-campus counseling services available at the local colleges, the 2 that fell in these 2 regions. And then some identified challenges that also came out of a few of the graphs in the key informant interviews. As we saw, approximately 25% of young adult marijuana users reported that they began using under the age of 15, as well as 20% of young adult alcohol users also reported beginning using under the age of 15. And then again, that reporting of continued stigma around mental health and substance use disorders, and lots of reporting, as we saw, of challenges accessing services in the community, such as wait lists, application processing, and costs associated. And then over 30% of young adults reported depressive symptoms, as we saw on that one graph. And again, reporting from the 3 different categories, seeming that young adults may not feel valued or included in these 2 communities. So these are some recommendations that came from Epiphany Community Services, who compiled all this data and put together the final report. So the first one is to provide support to existing partnerships and collaborations to identify ways to better coordinate access for services for young adults, and then explore the option of promoting mental health apps or virtual supports for young adults. This was something that came out of the Young Adult Focus Group. They had said they were interested in that. And then collaborate with employers of young adults to identify the best ways to support young adults, as well as all of their employees that are facing mental health and substance use challenges. And then conduct specific outreach to young adults when conducting the 2023 community survey. And lastly, identify ways to expand the marketing of available resources to young adults, because that was another thing that came out of some of the key informant interviews, that there may be more services that they're just not aware of, but they're not aware of them, so they can't access them. So kind of expanding that marketing of either, 988 or 211 resources is something that we're looking into doing. So most importantly, what are we going to do with this information now that we have it? So presenting the information to community serving coalitions such as this one, as well as Youth Can and Compass in Greater Sullivan County, and then sharing this information with young adult community serving organizations. So this information can help inform their action plans going forward. And then communicating this information back to those who we interviewed in the Young Adult Focus Group as well. So sharing the report with everyone that we spoke to that had a part in, this information. And then taking the information to the Upper Valley Public Health Council, as well as the Greater Sullivan County Public Health Council and the community as a whole. So sharing the report with a larger audience and being open to inputs on the next steps as to who we take this information to, as well as, what we do with the information. And then I just had some discussion questions that I'll read the first one, and then anyone feel free to interrupt. So does this data that I just presented accurately reflect what you're seeing in your community when it comes to young adults?
I'll say yes.
I think it's a bit of a tough question because, you talk about Sullivan County and Grafton County, and here I am in Windsor County, Vermont, bordering Grafton County. So I think it can vary depending on situations. I'm just, not to go off on a tangent, but I'm just thinking about right now, the big to do is the bad fentanyl that's floating around Claremont. I mean, I didn't know that there was such thing as good batch of fentanyl, but so I think things can change dramatically with very little notice.
I would say from the perspective of the schools that this is pretty accurate. As far as what we're seeing, we have, our social workers, our LADAC, they're working with specific groups of kids, and this definitely supports what we're seeing. And I don't know how the pandemic factors into it, but we have seen a substantial increase in mental health issues with students at school. And so I assume that's also, the broader community is experiencing that as well.
Yeah, those are all great points. So the second question is, how can this coalition or the organization that you represent use this information in order to better serve young adults?
So again, from the school district perspective, I would like to share this information with so I have a group this summer, which is my social workers, LADAC, and school counselors working together, kind of putting together an action plan. What are some of the things we're accessing a lot of different resources. We have a lot of information, and we want to make sure that we're not just throwing everything in the kitchen sink at kids, but that we have a really targeted approach. So this would be valuable information for that group. And we've designated a couple days this summer that they're going to work on an action plan moving forward.
That's great. That sounds like a great idea. And then looking at the list of recommendations, which I can go back to, is there any that you think would be the more beneficial to focus on as a group? See if I can actually go back. So does any of these stick out to anyone as, that may be the most beneficial to focus on?
Danielle, this is Andrea. I think exploring the option of promoting mental health apps or virtual support groups, while it's targeted here for young adults, I think that that's something that could benefit just our community as a whole, people of all age groups. So I think that that is, especially because we know we've identified that, wait lists for any age group is for mental health services is a huge concern and a huge barrier to access right now. So so I certainly could see that as something that, is something that we could potentially focus on that would impact a large group of our community.
Absolutely.
And I would piggyback off that and say that, one of the things that altogether that we're looking at is obviously how do we market these resources to young adults? We're trying to better understand how to better market on social media, better target these populations. That way they can get information to the resources that are available in their community. And even if it's, things that we're just putting on our social media on tips and tricks and, coping mechanisms, coping strategies, anything, how can we better market those to young adults? So that's something we all together are definitely looking at, is how to better reach that population.
If I may, I think going back through a couple of those slides, it appears to me that when they're talking to young adults, some of them say that they're not aware of what services are available, and yet at the same time, some say that there isn't any access. So it makes me think that there's some sort of a disconnect there between what they go looking for or what's being provided at the same time. So when we're trying to support young adults, and trying to reach them, it seems to me that the back door to that is it's the, for lack of a better phrase, the real adults are the ones that have to provide those things in some sort of, I would say, broad-based mechanism, so that I think the real change comes from not necessarily the young adults themselves trying to reach out to help themselves, because they may not have the capacity to do that, but more so the adults being aware of things that they can either, the three most popular things were their closest friends, their family, and, those three categories were the ones that had more influence than anything else. So if we can influence the influencers or provide them with what we're looking for, as she was saying, even the adults can use these health apps or virtual supports. like on the bottom rung there, it's like, well, we're not aware of what goes on, but we also know we can't get it. So kind of circling those three things together would make some sort of sense there, I guess, in terms of just kind of total community awareness. For example, this data that we have, I mean, we can share that. I mean, it's common that within this group, we share it with all these organizations that provide outreach and support and all that kind of stuff. But it's it's generally within this population. It really doesn't necessarily talk to people that are not aware of it. So if somebody comes to a counselor at a school and the counselor is aware of what this says and other programs that are there, that's one way. But in my mind, it makes me think that, well, an awful lot of this information is extremely valuable within the clinical and on the front lines, but there's not an overarching thing out there that says, oh, by the way, this study was just done and here's what we're finding out. To me, that's, I always think of headlines in the newspaper, and sometimes the headlines are kind of superfluous because they really don't affect that many people and it's a very small thing, but this is a very big thing. And I'm just wondering if our efforts to make more people aware shouldn't be, sending out press releases on this data that's available and then bullet pointing the stuff that seems to be the most significant about what people know and what they don't know. Are the general population aware that, children are 25% of kids 15 years old are using marijuana and alcohol for the first time? I'm going, okay, to me, that's a banner headline in the Valley News as to some important information. And then, of course, the backside is providing those mental health apps or supports for young adults or for the parents that, are part of that, support net. That was a little rambling, but it wasn't bad.
No, that was a great point, and especially in these two regions, it can be really hard to locate young adults themselves, like outside of the couple colleges that exist. So collaborating with the employers is something that we're working on doing by putting together a employer resource guide to kind of have the resources in one place together that are available if they see, or if one of their employees that is or isn't a young adult comes to them looking for information regarding those services. So yeah, definitely collaborating with employers is something that we are looking to do, since that's where we're finding most of our young adults in the two regions.
Interesting.
I think that anybody who works in school systems would not be surprised by that data. That we see it every day. It's in our bathrooms. It's, in our assistant principals' offices. One thing in some of the districts that I've worked in previously that's been successful, when I think young adults, I'm thinking high school age kids, is like a peer support group. Because I do think, some of those points that you just made, kids sometimes hear things from their peers better than they hear them from us. And so getting something like that going in the schools would be beneficial.
Yeah, absolutely. And then my last question was, is there a group or, an organization that you think would benefit from this information as well? If you think of one, you can always email the All Together email, or Hillary or Andrea or Lauren. And then, does anyone have any additional questions?
Oh, well, I would just state that if I'm thinking of a group that would find this valuable, I think a lot of the people that already know about All Together and all this information and this clearinghouse and catalyst of substance misuse and prevention and all that kind of stuff, most of the clinical people and Matt and people like that are right there on the front lines and they're well aware of it. I think the group that probably knows the least about it, especially with young adults that are at risk, are people who no longer have children within either the school or college system. My kids are grown and they don't live here, so I'm very naive about what these issues look like, what the numbers look like. So I think the group is adults that are, say, over a certain age or under a certain age that are not part of this whole network of people that are just totally unaware, other than the headline in the Valley News that says, we got some bad fentanyl over here. And that part of it is just kind of like, that's the effect. It's not really talking about the cause. It says, oh, by the way, 15-year-old kids are involved with this thing, 25% of them at such a young age. I think the general public as a group is the one that, I think Daniel would be great to do interviews on, public radio in New Hampshire and Vermont talking about this. That's right up, that kind of, news and group alley that's out there. Or, certainly with the Valley News, sitting down with one of their reporters and delivering this information. I think, instead of running 10,000 words on the back page about where birds live, which is nice, nothing wrong with that. I have nothing against birds. I feed them every day, but something like that seems to me to be more relatively important to our community here. And I'm going, I would rather read a story about that. Because of the data that's available, and that seems to be much more relevant to the resident population.
Yeah, absolutely. That's a great point.
Thanks, Danielle. If folks think of any questions or have any thoughts about where we could share this information or avenues that we should take a look at going down, please let us know. The next couple things on our agenda, we are going to go through a stakeholder interview report and then provide some updates on sort of where we are at with some mental health training. So I'm going to share my screen now and see if I can get this report up. Everybody can see this. I will make it, I don't want to make it too small. Is the font size okay for folks? Just give me a head nod. It works. Looks good. Can you all see this?
Yep, looks good.
Perfect. Thank you. Okay, so we'll briefly go through this. I just want to give a little background. So Andrea and Lauren and Danielle and I, as part of All Together, every other year following the YRBS data, administer a community survey, and that is geared at getting information from adults and caregivers in the region about what they're seeing in regards to youth substance use and youth mental health. And I know we've presented those findings before, and they are on our website at All Together. So we didn't want to go into the information from the community survey, but did want to give some background information in regards to the data that we're using and the reasons why we held these stakeholder interviews. So the Youth Risk Behavior Survey gets administered every other year. It was administered this fall of 2021. They put it on, and then last was in 2019. So we're hoping to get that YRBS data from our schools, hopefully this fall. And this will really be the first data set that we have that will show some of the impacts that COVID-19 has had on youth mental health and youth substance use. We did the community survey this past year. We put it on hold a year because of COVID-19. We aren't supposed to do that community survey if we follow the same sort of schedule until 2023. But we're thinking about doing it a year early so that it's following the YRBS data. Also knowing that our Drug-Free Communities grant, we are going into year 9 this fall. So anything that comes out of our community survey, we want to be able to have time to act on it before our grant is over. So we're thinking about administering that survey again this year. That way we can have some timely data that kind of goes in line with what we're seeing with the YRBS. So just wanted to give a little background information on that. So based off of the community survey results that we received this past fall, we wanted to hold some stakeholder interviews in both the Upper Valley with All Together and then Greater Sullivan County with our Andrea's co-partner, Darren, who's the substance misuse prevention coordinator in that region, to really understand, okay, this is what adults and caregivers are saying are, happening with youth substance use and youth mental health. What are the sectors seeing in regards to these issues as well? So in the fall of 2021, we held 21 interviews across both regions. 4 sectors were represented. Those were first responders, the education sector, mental health, and community service. And as you can see from the little word cloud, I guess you could call it, even though it doesn't really look like a cloud, mental health was the #1 concern across all 4 sectors that were interviewed. And alcohol and marijuana use were the second highest concerns. We're not super surprised by this response. This is kind of what we were envisioning we were going to hear from our sectors, especially based off of the community survey results and just what we've been hearing from individuals in the community. So based off of that information, we proposed an action plan for the spring of 2022. And Andrea is going to talk about the SAMHSA Talk They Hear You campaign. But I did want to, and we'll go into a little bit more into the mental health training updates, but we had scheduled, based off of our stakeholder interviews, 5 mental health trainings in the spring of 2022, 4 of those falling within the month of May, which is Mental Health Awareness Month, and then 1 would fall in the month of June. So I'll let Andrea give a little bit more information on what this Talk They Hear You campaign is, and then we'll dive into some updates around our mental health trainings that are in process.
Thanks, Hillary. So if folks were on the meeting back in March, I went into a little bit more in depth about this Talk They Hear You campaign, because if you remember in the month of January, we utilized our Sober Truth dollars. That's a supplemental grant of this Drug-Free Communities grant that we have. We utilized that to launch what we called a soft campaign of this Talk They Hear You campaign, and we had some pretty good results. So based on all of the sort of interviews, data, all of that jazz that Hillary talked about, we feel that it is appropriate to implement a larger scale campaign of this in the upcoming year, so fiscal year 23, utilizing again those Sober Truth dollars to really make an impactful or a meaningful kind of dent in the community, I guess I could say. So what we're hoping to do is we are going to be working with our current evaluators, Epiphany Community Services. They're the ones that Danielle had referenced. So we're going to work with them to hopefully be able to hold some focus groups, maybe some town halls, do some preliminary surveying of adults and parents, caregivers in the community. Again, this is separate from our community survey, but this is just for us to get some baseline data about essentially how, we haven't narrowed down the questions yet, but pretty much how confident people are feeling in having conversations with the youth in their lives. So whether it's their own children, if it's youth that they work with, friends of their children possibly. So again, we'll get a baseline of how comfortable are they to have these conversations. Are they already currently having these conversations? What are they talking about with their kids? And, then again, dive in a little deeper, have some focus groups about what are some barriers to why they may not be having these conversations, so on. And then the plan is to implement this full-blown campaign. So it would be social media, print, actual, flyers in the grocery store and things like that, letters to the editor, working with schools to disseminate some of this information home to parents and caregivers, things like that. And then maybe in April, May of 2023, we'll wrap it up with a post survey to really try to gauge what was the effectiveness of this survey. Did the information truly reach the people that we were aiming to? And did it make a difference? Did it make them feel more confident? So just as a quick reminder for this Talk They Hear You campaign, the goal is really to increase parents and caregivers awareness of the prevalence and risk of underage drinking and substance use. We hope to be able to equip them with the knowledge, skills, and confidence to have these conversations. And then we're hoping to actually increase the action. So for them to have the conversations, for them to develop action plans with the youth in their lives in terms of how to prevent underage drinking and substance use. So I just want to share that over the past month, we have also held two or three trainings that were aimed towards parents and caregivers in the Upper Valley region, Upper Valley / Sullivan County region, where we put out some of this information from the Talk They Hear You campaign. And an overwhelming response that we got through evaluations was that this information is really helpful because I don't even know where to start when I have these conversations with my kids. So when I look back at some of the data that Danielle talked about, specifically when she talks about the age in which people first use a substance, and she identified the age of 15, we know research has shown that the older that youth are before they, try this substance, and when we say try it, it's like truly trying it. It's not having one sip of alcohol out of their parents' drink that they snuck out or something like that, but really intentionally engaging in drinking alcohol or using marijuana. We know that the older that they are, it's just a greater outcome because it gives their brain more time to develop without the impact of substances on their brain. So, by having parents and adults and caregivers have these conversations at an early age with youth, we hope to see that number of age of when youth are first engaging with substances, we hope to see that number continue to increase. So that's just a little bit of a plan of how we've utilized the data and what we are hoping to do with this campaign and some of the outcomes that maybe we hope to see with that. Any questions? Because Hillary, we're holding off for 1 second on the mental health trainings, right?
Yeah, so I'll
Just
stop
go right into
sharing.
them?
We'll send this report out with the minutes as well. So I'll stop sharing and open it up. If anyone has any questions, then we can give updates on mental health trainings. Anyone have any questions about the stakeholder interviews that we conducted? And this is something that we're hoping to be able to continue to do. So on, an annual basis, hopefully have, conduct stakeholder interviews to get a better sense of, what's going on in the community from those who are dealing with it firsthand in regards to it's really helpful for us to talk to first responders and educators and those mental health and community service organizations to really understand what they're seeing firsthand when it comes to youth mental health and youth substance use versus relying just on the data that we're getting. All right, well, let's do some mental health training updates. And then if anyone has any partner updates, we'll have some time for folks to share anything that they want to share with us before we adjourn for the day. So Andrea, do you want to kick us off with the mental health training updates?
Sure. So over the past few months, if you all have been part of, the Public Health Council of the Upper Valley, or, I don't know if Dartmouth-Hitchcock in general, I know our supervisor has gone through and presented the results of the community health needs assessment to various sectors and groups across the Upper Valley region. But so basically over the past few months, we've just heard from a number of people, community partners, that mental health is a top priority in the region at this time. We're seeing it at the youth level. Danielle talked about it at the young adult level, and then our community health needs assessment that the hospitals do, that was identified for the general population, general community as well. So our substance use team at Dartmouth-Hitchcock in the community health department, so like we said, it's myself, Lauren, Hillary, Danielle, and then our coworker, Darren, who works primarily down in the greater Sullivan County region. We set a goal to hold 4 mental health trainings throughout the month of May because it just happens to be Mental Health Awareness Month right now as well. And so what we did is we identified 2 evidence-based trainings that we wanted to, or best practice trainings that we wanted to implement. So Lauren and I are trained in the Connect Suicide Prevention training from NAMI, New Hampshire, and then Hillary and I are trained as youth mental health first aid instructors as well from the national, I'm drawing a blank on the organization,
it's the National Mental Health First Aid Council, I think is what's the,
yeah.
It's got council in it.
Yeah, sorry about that. I'm drawing a blank on that. So those are the 2 programs that we have chosen to implement 4 different times throughout the month of May. So at this point, we have held 3 and are in the process of holding our 4th training at this very moment. So we want to just thank Angie Leduc at the Injury Prevention Center. She has been she's sort of our contact between NAMI New Hampshire and Dartmouth Hitchcock to be able to facilitate and set up and just kind of implement these Connect trainings. So we had, let's see, last week we held one for educators specifically, because if you're not aware, on the New Hampshire side, all school personnel, so it doesn't matter if they don't have to be a teacher, it has to be all school personnel in New Hampshire are required to complete 2 hours of suicide prevention training every year in the schools. And this Connect suicide training, it fulfills that requirement. So we wanted to give educators another opportunity to fulfill that requirement, that required training. So we held an educators training last week. It was virtual, and we had about 7 people attend that, which I'll get to why the number is important in a little bit. Right now, we're holding a training geared specifically towards first responders. Smokey's still waiting for his certificate. Thanks, Matt. Smokey the cat, who often joins our meetings with Matt, was part of that training, and he has not received his certificate for it. So I'll let Angie know. We'll get that for him. So we, where was I with that? Yes, so we are offering one right now for first responders. And then Hillary and I had a youth mental health first aid training for the general community yesterday. So that we had about 22 or so people attend that, and that was virtual, so that went really well. And then we worked with Valley Court Diversion, some of their staff and volunteers, to offer youth mental health first aid for that organization as well. So we're happy to be able to report that we have met this goal that we set for ourselves. You know, initially we anticipated training about 55 or more people, you know, throughout all 4 of these trainings. But what we have found is we get a bunch of people to register, and then we only get about half of the people that show up for it. You know, it can be for various reasons. We're not sure why. You know, we'll have to debrief a little bit more on that later to try to figure that out. But it looks like we're going to be ending with maybe 41 people that we got trained in mental health, you know, programming in the community, which is still really good. So I'm really proud of that number. That's 49 more people that we have in the community to be, you know, gatekeepers and youth mental health first aiders, and be able to support the youth in our community and take those skills and really be able to support anybody in their life. It's, you know, it doesn't just have to be the youth that they're working with. So, yeah, so I think that's kind of it. We, you know, Hillary and I, like I said, we held the youth mental health first aid virtually yesterday. It's a 6-hour with breaks virtual thing, and we've gotten some good constructive feedback from it. It's just not the same doing a training that long virtually as opposed to when we did it with Valley Court Diversion, you know, in person. So we, you know, we want to work out some of the kinks there and see how we can make it a better experience for people, because it's a really heavy topic and it's a lot of information to cover in a pretty, considering it's a pretty short amount of time. So, so overall, we're pleased with what we've been able to do, and we hope to come up with a plan to see if this is maybe something that we can make on a more permanent offering. So is it once a month we hold some sort of a mental health training so that people are kind of aware of it and know where to go to look for registration. You know, we need to debrief after holding these 4 trainings to see what is the most feasible and how we can reach the greatest amount of people each time. So I guess with that, Hillary, Lauren, do you have anything to add about the trainings or any questions?
Yeah, so I'll just add, so to give a little bit more information for the youth mental health first aid. So currently UNH Cooperative Extension has a grant that is allowing us to offer this training free of cost to participants. That grant was supposed to end at the end of June, and I guess has been extended through the fall, which we're really excited about. But we've also, when we wrote our year 9 DFC budget, we did budget for materials to be able to hold, to continue to hold youth mental health first aid trainings. We were not anticipating that there would be a cost per participant to utilize the Connect platform, which is where people do, there's some pre-course work related to the youth mental health first aid training. And that's how they receive their certificate, is they have to complete sort of a knowledge check and an evaluation post training. There is a little bit of a cost associated per participant to utilize that platform, which we didn't foresee when we wrote our DFC budget. But I think we will have some department support and potentially some wiggle room with some other budgeting dollars to be able to continue to hold this training free of cost to participants after the UNH grant ends in the fall. I will also add, we are doing a youth mental health first aid training for Camp Coniston on June 15th, which I'm personally really excited about because I'm a Coniston alum and super excited to get back to camp for a day. But that will be a 30, so this training is a max of 30 participants. So this will be a 30 participant training for their director level counselors at the camp. And I think what is really cool about this training is Camp Coniston employs counselors from all over the world. It's not just staff from the state of New Hampshire or Vermont or any of, our bordering states. They come from all over. They come from different backgrounds. So I think that's really cool, is we're going to be able to have deliver this information and build up these individual skills that they can then take back after summer's over, back to wherever they came from. We had more people in yesterday's training outside of the Upper Valley, which was the cool thing about doing it virtually. We had someone from Exeter, we had someone from more north. So that's like the nice thing about doing a virtual training, is we can have people from a greater geography come to attend. We also have been working with a woman at Dartmouth College who she's employed by Dartmouth College specifically through the JED Foundation, which is their mental health. It's not a campaign, it's like a mental health program that Dartmouth College has brought on. And I believe the JED Foundation is there for the next 4 years, I think is what they're funding. It's 4 or 5 years. And so Lauren and I met with this woman, Katie, who is the program manager at Dartmouth College for JED Foundation. She's only been in her role for about 3 months, but Dartmouth is really interested in bringing mental health first aid trainings to staff and faculty. There's an adult version of mental health first aid that is a little bit more appropriate for higher education. So Darren, who we've mentioned, she, as of today, just got certified in adult mental health first aid. And then this woman, Katie, if all goes well, she will also be certified today. So we will have 2 adult trainers that we can tap into to provide adult mental health first aid training at Dartmouth College, and hopefully some other adult organizations. Athletics at Dartmouth College has raised their hand to sort of be the guinea pig group to hold and take adult mental health first aid. So they're looking at doing 2 trainings. So that would be 60 participants. That would include coaching staff and athletic trainers to take this adult mental health first aid training. And then hopefully, if all goes well, they will open that up and do some further trainings of faculty and staff, both in undergraduate and the graduate schools. So that's exciting. But knowing that, we have access to 2 adult trainers, but then we also have access to youth mental health first aid trainers, we're able to facilitate and help get these trainings further out into the community, which I think is really exciting. But we've definitely hit some bumps in the road in regards to technology, and just the training is really long, and it's a lot of information, and because it's an evidence-based curriculum, we really have to follow fidelity, so we can't necessarily sway off of what's in front of us, which can be a little hard. But yeah, we're excited. It's nice that we have access to this information and we're able to put it out into the community, and it's seeming to go well from the feedback. Lindsay, I don't know, if having gone through this, if you have anything that you want to say about the training itself and the content that would be worth sharing.
Yeah, I think that it was really, I personally was very comfortable, and because I know Andrea and Hillary, and I think for someone who didn't know them, the feedback was that it was very helpful. So our volunteers who deal with youth on a regular basis that they don't know, so it's made, I think, asking some questions that are going to be hard to ask, or uncomfortable topics easier because we were able to practice. And I will just say that Hillary and Andrea did a wonderful job. So, yeah, no, I think it's something that's really important. And I like, it's cool to have like a lot of people in the training, but it's also good to do it for us. Like, we do a very specific thing here. So I think it was helpful because we could apply it to the setting in which we would use these skills too. So I see, pros to both settings.
Thank you, Lindsay, for that feedback. Lauren, anything you wanted to add from your front on these trainings or other mental health trainings?
No, I don't think so. You covered a lot, both of you.
So if anyone knows of a group, so the training has to be, you have to be over the age of 18 to receive the training. But if you know of a group or an organization that you think would benefit from this training, let us know, because we're willing to go to, like we went to Valley Court Diversion, we're willing to go to an organization and facilitate this training in person. It seems that in person is maybe the better way to go with this training. It's a little bit easier to facilitate the small group activities and answer questions in the small groups if we're not having to pop in and out of breakout rooms. So if you know of groups who you think would benefit from this, let us know. And also know that adult mental health first aid is also hopefully in the near future a really real possibility for us to help coordinate in the region too. So with that, we've got 10 minutes left. If anyone has any partner updates they want to share, now's the time. I'll open up the floor to anyone who would like to share anything with us. We're okay with silence too, so if you want to think about it for a second. But if no one has anything, that's okay too. Well, then I will end us by saying it is Mental Health Awareness Month, even though May is wrapping up. The news has been very depressing as of late, and just want to remind folks the importance of taking care of yourselves, practicing self-care. If you need to turn off the news and go for a walk, or turn off your social media to just take a break and decompress, just remember to take care of yourselves and lean on your support people in anything that you might need. If you need someone to talk to, let us know. We're always here, but just practice self-care. It is so important. And just wanted to remind people that we're here should you need anything. But thank you. It's a beautiful day outside. I encourage everyone to go soak in some vitamin D.
Thanks so much.
Thank you.
Thank you.